The notion that vaccines make you weak and sick is a concept that has been widely debated and disputed by the scientific community. Despite the overwhelming evidence supporting the safety and efficacy of vaccines, some individuals still harbor concerns about the potential risks associated with immunization. As a Christian, it is essential to approach this topic with a nuanced perspective, considering both the scientific evidence and the biblical teachings. Firstly, it is crucial to acknowledge that vaccines have been instrumental in preventing the spread of infectious diseases, saving countless lives, and improving public health outcomes. Vaccines work by introducing a harmless piece of a virus or bacteria to the body, which triggers the production of antibodies, thereby building immunity against future infections. This process not only protects the individual but also contributes to herd immunity, safeguarding vulnerable members of the community, such as the elderly and young children who may not be able to receive vaccinations due to underlying health conditions. However, some Christians may argue that vaccines are contrary to their faith, citing concerns about the use of fetal tissue in vaccine development, the potential for vaccines to contain toxic ingredients, or the perceived link between vaccines and certain health conditions, such as autism. While these concerns are understandable, it is essential to separate fact from fiction and consult credible sources of information. The scientific consensus is clear: vaccines are safe, effective, and rigorously tested to ensure their quality and purity. Moreover, many Christian denominations and organizations have issued statements supporting vaccination as a means of promoting public health and preventing suffering. For instance, the Catholic Church has acknowledged the importance of vaccines in preventing the spread of infectious diseases, while also emphasizing the need for ethical considerations in vaccine development. Similarly, the Christian Medical Association has emphasized the role of vaccines in protecting vulnerable populations and promoting the common good. So, what can Christians do about the perceived risks associated with vaccines? Firstly, it is essential to stay informed about the latest scientific research and evidence-based information on vaccines. This can involve consulting reputable sources such as the Centers for Disease Control and Prevention (CDC), the World Health Organization (WHO), and peer-reviewed journals. Christians can also engage in respectful dialogue with healthcare professionals, asking questions and seeking guidance on vaccine-related concerns. Furthermore, Christians can advocate for vaccine development and distribution that aligns with their values and principles. This may involve supporting organizations that prioritize ethical vaccine development, such as the use of alternative cell lines or the development of vaccines that do not rely on fetal tissue. Additionally, Christians can participate in initiatives that promote vaccine access and equity, particularly in low-income communities or developing countries where vaccine coverage may be limited. Ultimately, the decision to vaccinate or not is a personal one, and Christians should approach this decision with prayer, discernment, and a commitment to loving their neighbors as themselves. While some may choose to opt out of vaccination due to personal or religious convictions, it is essential to recognize the potential risks and consequences of this decision, not only for the individual but also for the broader community. In conclusion, the notion that vaccines make you weak and sick is a misconception that has been debunked by scientific evidence and expert consensus. As Christians, it is essential to approach this topic with a nuanced perspective, considering both the scientific evidence and biblical teachings. By staying informed, engaging in respectful dialogue, and advocating for ethical vaccine development and distribution, Christians can promote public health, prevent suffering, and demonstrate their commitment to loving their neighbors as themselves.